I'm Catherine Jones. I've been a medical oncologist here at UMC for almost 5 years in January. I decided to become a medical oncologist largely because my mother had breast cancer the first time when I was 13. And going through that with her when I was young was extremely difficult, watching her lose her hair and go through her chemo. And what impressed me at the time and what really motivated me to go into this from a young age was her relationship with her oncologist and how she really felt like he cared for her and had a special role in her life. And he ultimately ended up caring for her father as well. So when I was in medical school, she had her second breast cancer. And so again, that just reinforced my interest in it. And she again went to the same oncologist and had the same sort of close relationship with him and felt like he was so instrumental in her life and her care. That's what really made me choose to do oncology and made me have a special interest in breast. Because of her history and everything and my interest in breast, I knew that it was very important that I find out more information about what my risk was and what I needed to do as a patient in making sure that I reduce my risk in getting breast cancer as much as possible. And I felt like when I came here, I really wanted to carry that forward for our patients and help in developing this high-risk program so that we could find out what we needed to do for people and how we could best care for people who did not yet have cancer. When I did my initial risk assessment on myself, I discovered, which I didn't know previously, that my risk of breast cancer in my lifetime was about 34%, which is very high. And so I wanted to be instrumental in other people finding out what their risk was so that they could be motivated to take control of their health and get screened at an early age and hopefully prevent cancer in themselves. Our high-risk program here at UMC helps women to do that, so we can evaluate women who may be at increased risk for breast cancer, get them tested for possible genetic mutations associated if that's indicated, and then help them arrange their screening to do breast MRI or breast mammograms as they need, and then make sure they're on appropriate preventive medications if they're indicated, and make sure they're getting the breast surveillance they need with clinical exams. So the program we have here is really near and dear to my heart because I think hopefully we're going to prevent a lot of cancers with this, and I hope that applies to me as well.